Welcome back. For Donate Life Month, Dr. Richard Gilroy of Intermountain Health, the sponsors of this segment, wants people to remember that you can save a life and live a life at the same time through organ donation.
Rocky shares a local story that exemplifies that.
Amanda Duquette Roberts is a chef and a collector.
I've been in Las Vegas now for 15 years. I work at the Wynn at Allegro, and I am a chef. I like to collect oddities. Anything strange is great for me.
She's also a living kidney recipient.
I was diagnosed with a kidney disorder in my early 20s, like 21, 22. At the time I was diagnosed, I was already stage 3. So one of the things about kidney disease, a lot of times you don't even know you have it until it's already too late. I didn't find out about it until I was in a car accident, and they did an x-ray of my back, and they saw that my kidneys were calcified. And the first nephrologist that diagnosed me told me in about 20 years I would need a kidney transplant. In May of 2021, I was diagnosed stage 4 and put on the transplant list. And when they first told me I was on the transplant list, they told me getting a deceased donor takes sometimes 5 to 7 years for my blood type, which there's hundreds of thousands of people waiting for transplants, and people die every day waiting.
A statistic Intermountain Health is working to lower. Dr. Richard Gilroy, medical director of Intermountain Health's liver transplant program, explains that Nevada is actually underserved when it comes to transplantation.
Currently in Nevada, there are 640 people or thereabouts awaiting an organ transplant. In situations, one organ donor, someone who considers organ donation, and family members who support it in the era of a tragedy, usually for them, that they can save as many as 9 lives.
Becoming a hero, like Amanda's sister-in-law, Joan.
She came to my rescue. So she went and got tested, but she was the wrong blood type. But through the paired exchange program, we were able to find a match that was probably even better than my family would have been.
What happens here is that Joan, who was the donor, is the individual who starts what's called a chain. And in a chain, through the National Kidney Foundation, her organ can go to another person in another place where her organ is a match, and in exchange, another organ from another individual within that sequence can come back to her. All that came together to lead to this, what I'd say, perfect chain.
People tell me every day how much better I look, how much healthier I look, and I can feel it. It's just it's really life-changing.
Amanda and Intermountain Health are dedicated to keeping communities informed and keeping new kidneys healthy.
In kidney disease can come back. And in her case, her kidney disease isn't something she chose. It is something that occurred because of an immunologic injury, meaning that your body reacts a certain way against you. That could happen with the donated kidney. So we monitor for that. And we prevent it by keeping the monitoring going and making adjustments to the medications that she'll require for life.
Which is why gratitude and giving back are the main courses of Chef Amanda's menu.
It's one of those things you don't know how to say thank you enough. I've said thank you a million times, it'll never be enough. And honestly, the reason I'm doing this is to try and pay it forward. If even one person finds out about the kidney exchange program through me and goes to look to be a donor, I'll feel like I've done my part.
Thank you, Intermountain Health, for sponsoring this segment. For more information, you could head to intermountainhealthcare.org/donate life.
There's more Las Vegas Now just ahead. We will be